Hey, I'm Jake Meyer with WAVE Physical Therapy and Pilates. I'm here with part 3 of how to see why you have knee pain, getting to the root cause. We've already looked at mobility and control. Now we're checking out strength. So 3 little drills you can do to check the strength of your knee is going to be a glute bridge, a wall squat, and some mini band walkouts. So for the glute bridge, what you do, you lay on your back, have your knees bent close to 90. You're going to think about some core tension and glute tension. You're going to tighten your belly, squeeze your butt, and simply raise up. I'm looking for no pain in the back, preferably no pain in the knee. Height, if you can get all the way straight through here, that would be ideal. But really looking for that control coming from our backside and our core, okay? We're not trying to arch the back up. I really don't care how high you go initially. I want it to be literally as pain-free as possible, okay? Again, maybe look for 5-second hold and repeat that for some fatigue. Maybe get to 20 repetitions or so. The next one we're going to try is a wall squat. So the glute was working the bridge was working our backside. This is going to work the front thighs more. What you're going to do is lean on a wall. You're going to slide down a little bit, making sure your knees are over your shoelaces. If your feet are too far out, bring them back in. If your knees are on over your toes, maybe put the feet out just a little bit to begin. And then as far as depth, you just come to a height that's pain-free, okay? So if I start feeling pain here, I'm gonna come up above it and hold it. This is another exercise you can do for maybe total time, looking for 1.5 to 2 minutes of hold. And here's a side view of what it would look like coming down. Like here would be ideal if you can get all the way down to 90 degrees. Again, if it's a little too much, just go to the height that your body's able to do. Keep our back flat and holding it there. And then just repeat as you need to. And the third and final one I'll go over would be a banded side step. So you have access to a rubber band. What you would do is feed it around your knees. Starting at your knees will be easier. It'll be harder at the ankles. However, that could tweak the knees a little bit with that extra strain. So start, knees are bent, simply stepping sideways and stepping back. Maybe get like 3 to 4 steps each way. If you have a long hallway, you could go all the way down the hallway. But what we're trying to target here is the side of those hips. So when you were doing that step down test earlier, if that knee was wobbling a whole lot, turning that step down test into your treatment, and this should help stabilize that knee, getting those hips stronger, helping get that pain out of that knee over time. So none of this will be necessarily a magic bullet where you're going to feel fantastic right away. It's going to take a couple weeks a lot of times of doing that. But even after just a few sessions of getting some muscles just turned on, you usually can see a pretty good difference of some pain reduction. I'd love to know which exercise you found to be the most helpful. Like or comment that below and follow us at WAVE Physical Therapy and Pilates.